Okay, so we are live. Welcome, Dr. Hamza, for today's session. Thank you so much for making it despite your busy schedule. I know it gets quite tough when we have a working schedule, especially in Ramadan, but we are really, really happy that that you made it
It's
today.
cutting
Okay,
off.
so we are live. Okay, so before we start, I just would like to introduce Dr. Hamza to everyone.
I cannot hear
You cannot
you.
hear me?
There is echo. There is like echo. What you were saying before, now I can hear it. So I hear
I
two
think
voices at the same time.
I think it's because of the headphone.
Okay.
Yeah, is it better now?
Yeah, it's better.
Okay, perfect. So before we start, I just wanted to introduce Dr. Hamza to everyone. He is a urology specialist working in Al Tawam Hospital for a lot of time now, and he is one of the key members also who in the department will look after the residents. Is also one of the panel members when it comes to the residency interviews, and also averages around more than 700 cases per year in every field of urology, including endourology, laparoscopic procedures, andrology, and many more. Dr. Hamza, I might have missed something about you. Why don't you go and introduce yourself so that everyone is enlightened about who we are?
Assalamu alaikum. Hello, everyone. I'm glad to be here. Thank you for having me, Dr. Mustafa. And I'm always happy to share anything that can be useful to anyone who's interested in urology and or wants to know more about urology. So I'm here for that, and let's do it.
Dr. Hamza, before we start, how about you give us an insight? Why did you choose urology?
Well, it's a long story. When I was medical school in my final years, uh, I was more towards general surgery, and I joined the general surgery program for 4 years. After that, I left, and honestly, I never thought that I will be joining urology. So it happened. I joined urology, and I found it really interesting, very interesting field. You can say it's in between medical and surgical. It's more towards surgical. Still, there is a good medical part in urology. And it's really interesting the variety of cases you see in urology, from simple urological procedures to endourology to open surgeries, laparoscopic surgeries. So there is really good variety of cases you see in urology.
You said that you were also into general surgery and then you came into urology. How
Yes.
different do you feel are these two specialties?
Well, both of them are good, to be honest, but for lifestyle, I think urology is much better. Because general surgery, you are in general surgery, you are still in your first year, and I'm sure you are suffering enough. And you know how general surgery is. General surgery is a very good specialty. However, it's really busy, it's really exhausting. And yeah, so the only difference is, I would say, lifestyle. In urology, you will have better lifestyle. Plus, as I mentioned before, in urology, there you will be seeing more variety of cases, and it's some cases will be like towards medical.
Okay. So you feel that having a background in medical and surgical combined together will give you a good exposure into urology. Okay. One other thing is how competitive is it to get into urology as a specialty?
I think at Tawam Hospital now I would say it's competitive because it's only 2 seats per year. So for the time being, it's really not easy. I don't know about other places, but I will speak in Tawam about Tawam because I'm in Tawam. I would say it's not that easy to get into urology in Tawam Hospital.
Okay. So what do you feel that a person should do if he is looking for a seat into urology in the Emirates?
Uh, Well, you have to show you have to show us that you are really interested in urology. You can do that by doing rotation in urology. Maybe do a research in urology. This is a very good. This is an advantage. It will be advantage for the candidate. Plus, you have the MRE exam. You have to get a good score in MRE exam. But I would say the key MRE exam plus showing interest, not saying that I'm interested in urology. Honestly speaking, we see many interns that come to us and say, "Oh, I am interested in urology," but you cannot really see this. You should see this by being there all the time, showing yourself, showing your interest in urology. This is very, very important because people will interviewing you are the same people you are working with during your internship. So it's very important to impress these people who will be interviewing you.
Okay. So, do you feel that there are any special skills that a person should know before applying for urology, or any basic graduate is more than welcome for this field?
Uh, no, I mean skills. I wouldn't say skills, to be honest. As an R1, you are not expected to know too many skills. You are here to learn. You are here to gain these skills and improve them. But at least you should have an idea about emergency cases in urology, of course. Cases like hematuria, urine retention, stones, periapism. These things are very important to know when applying to urology because these are the emergencies that you will be seeing even when you are R1 and you have to deal with. So you have to have an idea about these things. But skill wise, not really.
Okay. Since you said that the field is very competitive to get in, what do you feel the candidates can do to make their profile stand out? Like, what are the things that you look on at a CV for candidates applying to urology?
Uh, well, background is, of course, we will start with the background, which university, what was your score at university, plus if you have any researches in urology, as I mentioned before, this is very important to have research in urology and the specialty you are applying to. This is really very important. So I would say these things, plus the MRE exam. Of course, if you have scored better than others, this will be taken into consideration.
Okay, perfect. One other thing that many people have a query about is that this position for urology, when it's open for residency, is it only for local graduates or for even international graduates who have completed their medical education abroad?
No, it's not only for local. Anyone can apply. Anyone.
Okay. And what do you feel would be the competitive spirit for them? Because most of them would be like, okay, should I even have a try? Because since you said that there are two seats, should foreign medical students apply for this position?
Yeah, if you are well prepared, if you know that you worked hard to get this position, if you know that you did your researches, if you know that the people are interviewing you know that you are really into urology, I think you should try. Why not? You should.
Okay, perfect. All right. So, since you mentioned this about foreign medical graduates, everyone who joins into a residency, they look at a prospect, like, what's going to happen after 5 years, after 10 years. So, what is the scope once you get into urology?
Honestly, for me, I've been in urology now. I finished 4 years in urology, and I would say I'm ready to do most of urological procedures that any specialist expected to be doing. I'm ready to see patients in emergency and manage them by myself. Of course, in some cases, when you have like sick patients, you have to go back to your consultant. This is for sure, just to let him know, just to protect yourself. But I'm ready to manage all the emergency cases. I run OR, endourology OR by myself. You saw that. And I do all the urological procedures, basic urological procedures. I'm very confident. The good thing now in urology, we don't have many residents. So for this year, we have 2 residents. So it will be really focused education for them. So if they show the interest and work hard, they will get to know all the skills they need to know, and they will be I would say competent specialists when they are graduated.
Okay. That's really good to hear because this is one of the most crucial points as well, because focused education during residency is what shapes them up. Moving on, what do you feel, apart from lifestyle, are the advantages of being in a urology residency?
As I told you, urology residency now, it's new. It opened only this year. So number one advantage is you really get all the education. We have too many consultants focused on teaching to residents. You
Okay.
have exposure to more cases, because when you have many residents, all the residents want to do cases, want to go to OR, so there will be competition when it comes to that. But in our residency program, now we have only this is really, I would say, a very good advantage for the residents in urology.
Okay. Do you feel like, there's every program and every residency program that's learning, there's a curve, even for residents, even for the department, even for the consultants. Do you feel that there are any challenges or disadvantages in the program yet, as urology in general?
Well, I would say the only disadvantage that it's a new program. Like they say, when the parents have their first newborn, there will be some mistakes in raising him, because it's
Correct.
the first child. I would say same applied into urology program. Now, because it's the first year, I'm sure there will be things that needs to be improved, needs to be changed, and day after day, we are trying to find these things and make them better. So this is the only advantage.
Okay, perfect. Because this is a positive step, because there is a problem that is rectified, that's moving forward. I think this is what many people would be satisfied with when they're looking at a residency program. Because once you have a change, that's when you know that things are going to get better.
Hmm. Of course.
All right. This is a usual question for every residency program, but I don't think it will apply for urology. Is the program toxic?
No, you saw our urology. You
Yes,
saw it.
yes. In fact, Dr. Hamza has been my mentor when I was rotating in urology. It was one of the most pleasant rotations. However, it was short a period of time. I wish we would have got more time to spend in the rotations, but hopefully in the coming years. And one best thing about urology is that it's open at any time. Even though you're not rotating, you can visit the department, you can get hands-on the cases, you can be involved with the department. That's a really plus point for this
Yeah,
department.
sure.
Okay, coming down to the learning opportunities for residents when they are in the program, what are the different types of learning modes that residents get on hands to?
I didn't get your question. I'm sorry.
uh, when we are discussing about learning opportunities for residents, what are the
Yes.
different modes of learning opportunities that the residents get on?
Okay, so we have. I mean, if you attend the clinic only, this is one way to learn. When you see how we see patients in clinic, what question we need to ask them, what we need to know, what we need to do with them. This is number one. Number two, we have our before OR, we have our procedure, which is in the clinic, where we do flexible cystoscopies, we do suprapubic catheters, we do change of catheters, bladder irrigation, even ultrasound. All of these things you can find in our clinic. Then we have OR, and in OR we have variety of cases. We have IVF center, as you know, in Tawam Hospital. We have endourology cases. We have laparoscopic and open. So all of urology is covered in Tawam Hospital. All of cases in OR. In OR, I mean, where it's the place where you will learn the skills. and you will be able to learn hands-on. Yeah.
This is actually a really good point, which I remembered and recollected as well. One good thing about urology program is that most of the procedures or everything happens at one place. So you have a clinic, and you have the procedure room, and you have the OR, and that's all running in sync, which is next to each other. So I feel that urology is a program at a whole and at one place. So a resident can get hands on anything. They don't have to run places to, or to make themselves worried that, okay, am I going to get exposure here or there or not? So that's a really good point. All right. So, since we were talking about learning activities, I wanted to just inquire more about educational activities for residents. I think like academic days or journal clubs, or how do you feel that goes on for the residents?
It goes on very well. We have our academic day once a week. It's 2 to 3 hours, and I mean, for now, I've never seen this in any program where you will find most of the consultants attending the academic day. So in academic day, each resident will prepare a subject. He or she will be presenting, and there will be discussion with the consultants. Plus, we have our radiology meeting, we have our pathology meeting, we have our journal club, and plus in the morning meeting, of course, we discuss cases on daily basis. We discuss the different images, CTs, ultrasound, MRIs. So I think education really is very well covered in urology program.
Okay. Speaking of radiology, journal club, pathology, how do you feel this shapes the residents when they are learning? Because since you said that this is a medical and a surgical field, theoretical knowledge is more important as well. So, do you feel students should have a background knowledge before applying?
You mean about pathology and radiology and these things?
Yes, about the educational activities in general.
Of course, they should know. They should have an idea at least. They should have an
Okay.
idea about what's going on. They should. I mean, they should know about. Of course, in medical school, you will learn pathology, radiology. All these things are things you see in medical school. But when you are in, for example, urology, it will be more focused on urology. So the learning chance will be much more better.
That's actually a really good point. I agree with that. Uh, Apart from this, what else do you feel a resident should be keeping in mind before applying to this program? Because this program, obviously, if you look at general surgery, it's a very broad field. You can super specialize in anything moving on after your residency. But urology, it is already a super specialized field. So, what do
Yes.
you feel they should keep in mind when choosing this? Because once you're there, you have no much options to explore.
Yes. So when you are in urology, as you said, it's like you can say it's subspecialty already. But in urology, we have, like, I would say, we have our general urology. After that, we have, you can specialize in endourology and andrology, uro-oncology. So these are three different fields you can be specialized in when you are in urology. So
Okay.
even after being in urology, you can still improve and get more.
Do you feel that there are scopes for fellowships in this country or abroad with this program?
Of course, there is. We have our consultants. We have two consultants from UK. One of them is specialized in endourology, one in uro-oncology. And we have two consultants from France. One is specialized in andrology and one in endourology. So fellowship, of course, there is a chance for fellowship abroad. In Tawam Hospital, for the time being, still not open. Uh, but you have chances everywhere, I mean. And even if you are in Tawam, even if it's not a fellowship, after the graduation, I think you still can choose what field you are really interested in and improve yourself in that field.
That actually makes more sense. Speaking of which, are residents given more opportunities on research?
You mean you are asking if they are given a chance in research?
Yes, like what is the scope for them? Like because resident, it's a learning curve.
Yeah.
So are they given chances to do researches? Are they supervised? Do they have a mentor for it? How is it?
Yes. I mean, we have two residents now, and I think both of them already have done and are doing researches in the first few months. We have our consultants. We have two of our consultants. Uh, I would say three. We have Dr. Faiz Hamad, but he's not permanent. You know, he's sometimes in UAE University. But we have Dr. Aftab and Dr. Hidayat. Both of them are interested in research and in monitoring research. And really, if you go to them and ask them, for me, they were pushing me all the time to do research. Even without asking them, they will be pushing you to do researches.
Okay, so that's a really good point because residents who are interested in research will actually make their career path more fruitful because that's when you have the ability to explore about what you are specializing in. That's a really good point.
Yes. I cannot hear you. Hello?
Sorry, we lost you there for a moment. Technical issues.
I thought I lost you. Okay.
No worries. So we were talking about the board, which the urology department is following.
It's under Arab board and
Okay.
ACGMA accredited program.
Okay. We have heard that there is something called as Emirati board that is coming up. Is that going to affect the urology program in any way?
I don't think so.
Okay.
Very, you know, and a urology department in general in Tawam Hospital is very strong department. I would say, if not the strongest, one of the strongest in UAE. Because you know Tawam is tertiary center, and we have its oncology center as well, and it has its own IVF center. So we get referrals from all over UAE. So I don't think it will be anything will be affecting the urology program in Tawam Hospital.
All right, that's great to hear. Uh, when you're rotating in a urology department, since you said it's a medical and a surgical field, are the residents getting exposure in any other departments as well in the hospital during the rotation schedule?
Yeah, of course. They have, I mean, I think half of their first year will be in general surgery,
Okay.
all the basic surgical skills. And they have rotation in radiology, in nephrology, in ICU. I'm not sure about all the rotations, but they have in vascular as well. So they will cover almost all the other specialties during their rotations. Even they will be doing pediatric surgery, where they will get exposure for pediatrics urology.
Okay. I think nephrology will also be a part of the schedule, right? Since it's the medical field as well. All right, that makes more sense. Um, all right. One other thing is, how do you feel that Tawam Hospital has grown itself, uh, as a separate entity for urology when compared to the other hospitals? Because I feel uh, Tawam Hospital has actually secured a lot for urology. What is your take on that?
Yes, you saw our department. We have like I think six clinics we have in urology department. We have our own OR. We have our own ultrasound room. This I don't think you will see it in any other urology department where you will have your own ultrasound room. We have our own procedure room. So it's really very strong, very well established department.
One other thing is, since residents are on a learning curve, they are trying to get better with their skills, so with their knowledge and everything. There are sometimes that they can go the other way, they can make an error. So how do you feel is the protection for the residents and to cope up from that scenario?
See, for the residents, they are always protected, to be honest, unless the resident himself or herself does a mistake because they don't get back to their senior. This is the only way that resident maybe will not be that protected. But always the resident will be there second, or there will be a second on call with them during their calls. They can call at any time. And even if they are not comfortable and they want their second on call to be there at the hospital, the second on call has to go. This is number one. Number two, in OR, they will be working always under supervision. And
Mm,
senior you are working with has to know your limitations, has to know the difference between R1, R2, has to know the difference from one resident from another resident. So there will be always supervision, and there will be always, like, I wouldn't say restriction, but safety. So your senior, for example, in OR, they will let you do things that they know you know how to do now.
correct.
And things that they think maybe little advanced for you, they shouldn't let you do them. And this will come with time. You will build up your skills with time. 1 month after another, you will find out that you really earn too many skills in a very safe way.
Okay, that makes sense. Since we already spoke about research a while ago, there's one thing that people would want to know is the exposure to workshops and conferences. Do urology residents get exposure to workshops and conferences?
Yes, of course. So far, I think in Tawam, we did like 2, 3 workshops about Foley catheter, because Foley catheter, some people will say at the end it's Foley catheter. But I think you saw the
The
things,
number of false passages?
yeah, with Foley catheter, urethral injuries, difficult catheterization, all these things, you saw them yourself. And conferences, yes, of course, residents are always welcome to attend conferences, and it will be arranged by the program. They don't have to do anything. All they have to do is attend the conference.
Okay. And you feel that attending these workshops will obviously impact on how they work for their skills in the OR settings as well.
Course, of course. I think in the future, even we are planning for dry lab, wet labs. These things they will get as
Okay.
well. Yeah,
That's really nice. And how do you feel is an on-call schedule for residents?
I think it's very fair. The residents
Okay.
get like 1 in 4 calls per month, And the calls in urology, I mean, as I said before, you will be always with the senior. You will always be protected. And I don't think the calls is that busy. Honestly, there is no post call in urology, but if you had a busy call, which rarely happen, you can always say, I had a busy call, I need to leave early, and nobody will stop you.
Okay.
Yeah.
When we are talking about the surgical field and getting the OR hands-on experience, there's always a term that people use like earn your case. Because as residents, you are supposed to take care of the inpatients, take care
Yes,
about the ward before you actually, present yourself to be on a case. So many people would, or many residents, not even residents, like many prospects that are trying to come to the urology, would always have this in mind. Okay, I am a resident, I need to get hands-on, but
yes,
sometimes they lack the understanding that they need to be aware of their responsibilities before they get hands-on a case.
exactly.
So what's your message to them when they are trying to approach this situation?
The first thing and the most important thing is to know your patient, know why the patient is in OR, what we are doing for the patient. You should know if he has enough, like, for example, if he had enough pre-op investigations. If anything, we should be aware of before starting the surgery. I mean, all the patients, when you book them, of course, you will investigate them. They will go to a pre-anesthesia clinic and all this. But sometimes, for example, patient on anticoagulants, that nobody, I mean, noticed that he's on anticoagulants. So these things you should pick up. You should know about the patient before going into OR. This is number one. These I would say this is for elective cases. Post-operatively, you should follow your patient. You should know what are the red flags you need to know about each case, and this you will know with time. But at least you should know what's the intake output for the patient, especially major cases. For example, drain output, DVT prophylaxis, diet. These things you should know. And for emergency cases as well, you should work up the patient yourself. You should follow him. You should make sure he's booked in OR and everything is done for him before going to OR. So these are, I would say, simple things, but very crucial.
Correct. I think we have like cumulatively discussed everything about how urology is. It's a very a small and beautiful program, and people who understand it will enjoy it. It's not like you're going to work a single day. You're going to enjoy every day. You're going to be there. That's how the outcome of this program would be. Before we end, there is one thing I always like to end it with is how, like, if on a timeline, how would you describe a schedule in a day of a urologist? So, like, since the time you wake up, since the time you go back, what do you feel, or what all departments do you visit? What's the timeline?
I mean, in urology, most of the days you will go and you will finish on time. Most of the days. It depends. Some days you are in OR, some days you are in clinic. In OR, of course, for example, I will give you example about a day in the clinic. In the clinic, you have your clinic that starts, for example, 8 in the morning, finish 4:30. You have booked patients. You have 1 hour break in between. Sometimes you don't get the chance to take this 1 hour. But anyway, you have your patients booked. You see them. You treat them, investigate them, and then at 4:30 you are done. مع السلامة. If you have OR, same applies to OR. You have booked cases that will be approximately will be done on time. But sometimes you will have, of course, add-ons, emergency cases, where you will might take little longer. And plus that, you have the on-calls. On-calls, we don't do, we do our calls from home, as you know. And most of the time, you don't really need to go to the hospital to do something major. Sometimes you will have difficult catheterization, hematuria, these things that you need to go yourself at night or early morning. But most of the time, to be honest, the call is straightforward admissions. For example, obstructing stone with acute kidney injury, like scrotal abscess that you need to book for the next day to OR. Otherwise, emergency, I mean like trauma, these things, these major things, you will still see, but not that much, to be honest.
Perfect. I think we wrapped up pretty well on this thing. We'll just take a few questions from the chat. I think someone just asked us, it's a sensitive question. What is my scope as a non Muslim to secure a seat? Because I have seen very few non Muslims in this field. Do you feel that this is something to worry about?
Not at all.
Yeah,
Not at
I think.
honestly speaking, because I'm Muslim or we aren't Muslim, but really anyone who deserves the seat will take it,
Perfect.
regardless from what is his religion or any of these things.
Exactly, because for the program director, it's just your CV, your scores, and your credibility, your profile. They don't see where you come from or what you have, what you are. That's actually correct. We have one of our residents also watching us. Best program ever. And is knowing Arabic a must for urology resident?
I wouldn't say it's a must, but it's an advantage, to be honest.
Because most of the patients you see are locals.
Yes, but it's not a must.
All right. I think that's it for the questions on the chat as well. I think it was very beautifully explained. Thank you so much for taking out time from your busy schedule and enlightening us about urology. I feel people who are motivated will get through their specialty and have a chance of working with you soon.
Yeah, inshallah. Everybody is welcome. Anyone can apply. Just work hard for it, and inshallah, you will get it. Best of luck to everyone. But I would say at the end, sometimes when you finish your internship, you will be a little excited that I want to do surgery, I want to do something that is really difficult. But after a few years, you will realize that maybe it was a wrong decision. So my advice to everyone, I mean, see what is your priorities, and based on that, you choose the program. So, for example, if your priority is a good lifestyle, but you still get excited to general surgery, I wouldn't recommend you go to general surgery because your priority is a comfortable lifestyle. So you should know your priorities from the beginning to make the right choice. Sometimes you make wrong choice and it's never too late, as they say. You can always change, but it's better to change wisely from the beginning. This is what I want to say. Best of luck for everyone. Thank you, Dr. Mustafa, for having me.
You're welcome. But before we end, we have one more question on the chat if you would like to answer it. Is the score of 80% and transcript required for selection criteria? I think there are new guidelines by Department of Health that requires a minimum GPA score, minimum EMBRI score. So would you feel that the urology department would follow that guidelines as well?
I think somehow they will follow. I mean, it's a balance. At the end, it's a balance. For example, if a candidate applying, he got excellent score at his medical school, and he has good background about urology. He did researches, he did rotation with us, and we know him, but he didn't get a very good score at EMRI. In this case, I think we will have to ignore the EMRI score. You know what I mean? So
Correct.
at the end, it's a balance. It's not only one thing, it's a balance.
Correct. I think that sums up everything for all of them who have questions. Thank you so much for your time, and I hope you have a pleasant evening.
Thank you. Same to you. Thank you. Bye-bye.
Bye bye.